an innovative care model. i²TransHealth. Life in the countryside is idyllic, peace and nature instead of noise and traffic. But there is one serious drawback: inadequate healthcare in rural areas. There is a lack of medical and mental health professionals. This is a challenge for all people who want modern and professional healthcare from qualified professionals. This includes trans people. Their gender identity differs from the gender socially attributed to the sex assigned at birth. The shortage of professionals and lack of knowledge in rural areas hits queer people, which includes trans people, particularly hard. Many trans people are discouraged when they cannot find trans-informed physicians, mental health professionals, or appropriate counselling centres close to home to begin their transition. The i²TransHealth project has been brought to life to close this treatment gap. The aim: to enable trans people in northern Germany to receive multidisciplinary treatment, even if they do not live in large metropolitan areas. The service initially existed in the form of a scientific study. The goal is to improve health care for trans people through an e-health model that includes video consultations by specialized therapists and additional support from a local network of physicians in northern Germany. All trans people living in northern Germany, more than 50 kilometers from the Hanseatic city of Hamburg, were eligible to participate. This eliminates the need to travel to the Interdisciplinary Transgender Healthcare Center Hamburg, located at the University Medical Center Hamburg-Eppendorf. There are two groups: an intervention group and a waiting group. Those who were assigned to the intervention group could immediately begin treatment in the form of video consultation. Participants in the waiting group started after 4 months, either also with the video consultation or an admission to regular transgender care at the University Medical Center. What exactly does e-healthcare look like? A video consultation every 2 weeks. A chat for questions on the e-health platform. Participants can get quick answers from their therapists, even outside of the video consultation. And if immediate support is needed, help is available from a network of physicians close to home. In this context, i²TransHealth does not replace the existing counselling and care infrastructure for trans people, but complements it. To classify the results of the study, some facts around the scientific procedure are important. The age range of the sample was between 18 and 60 years. Individuals of different gender identities participated in the study. i²TransHealth has reached both rural areas and mid-sized urban areas. And people with different levels of education participated in the study. A total of 174 trans people were included. First and foremost, the i²TransHealth study team asked about general symptom burden. This includes somatization, depression, and anxiety. In addition, the study team queried and evaluated the impact on quality of life. i²TransHealth is effective. E-health is an indispensable tool for reaching trans people in underserved regions. The helpfulness and open-mindedness of the supervising therapists is also praised. Video consultations and chats enable new forms of interaction, which are very helpful for the participants. The treatment satisfaction is very high. Participants in the intervention group are more mentally relieved, less anxious, and have a higher quality of life than those in the waiting group. Waiting time for medical care and psychosocial counselling has a negative impact on the physical and mental well-being of participants. An e-health offering like i²TransHealth can be the first access to specialized trans healthcare for many trans people. E-health can change healthcare for trans people for the better in the long term. not only in Germany but all over the world. More information about the study and the program is available on the project website. An innovative care model. i²TransHealth.